Good morning, everybody, and welcome to today's CME on the simultaneous use of hyperbaric oxygen therapy and neurofeedback. This is indeed a new international paradigm that we've introduced at King Ahmad American Mission Hospital. And I want to give you a little bit of the background and also some of the evidence behind what we believe is a promising new era in neurology, neuroscience, and neuropsychiatry. Now, King Ahmad, of course, is our wonderful, prestigious, beautiful tertiary hospital. But one of its roles, in addition to providing care to the citizens of Bahrain, is to be a seat of innovation. And this is something that we in our Department of Baromedicine have really enjoyed embracing, realizing that not only are we situated in the center of Bahrain, but also have been able to attract a number of patients from the west coast of Saudi Arabia. So the influence that we're having is in fact larger than I had originally believed. Now, our department's quite small in terms of the clinical roles. We have myself, Sister Husky Smart, who takes care of the advanced wound care, and my wife, Sister Lucy Cronje, who does the hyperbaric medicine. And amongst the three of us, we support 7 service lines. So there's the hyperbaric oxygen therapy, the advanced wound care, transcutaneous oximetry. I do independent consults on vestibular and balance rehabilitation and tinnitus retraining therapy, as well as aviation diving medicals and neurofeedback. Now, for those of you that haven't seen our department yet, there have been some changes for those who have. I'm just going to take you on a short video tour. So we're on the first floor in the same wing as the laboratory, and there's our frontliner, Duha, sitting proudly and waiting for the next patient. And here we have Sister Husky Smart's office, and opposite the station for the advanced wound care that we provide in our unit. This is the changing area where patients go into hospital clothing, 100% cotton for safety reasons. And here's our neurofeedback room, where Millicent Cronje provides the neurofeedback to patients, which we also do apart from the hyperbaric treatment. Here's my office and our 2 chambers that we've named Baloo and Bagheera for Bahrain. And there usually Sister Lucy Cronje sits, and just giving you the 360, and that's our transcutaneous oximetry station. Moving outside next door to where the blood bank used to be. And this is now the multi-purpose center for aviation and diving medicals, vestibular and balance, tinnitus, as well as point of care ultrasound that we provide here. Now, hyperbaric oxygen therapy by now may be familiar to some of you, but I just want to give you some of the touch points that have brought us to this space where we're now combining the 2 modalities that I mentioned. First of all, hyperbaric oxygen therapy is a tool to provide oxygen under increased atmospheric pressure. So it's a tool to dose at a higher level of oxygen than we can in any other way. And it has been used over the past 100 years and more for the treatment of a number of conditions, some of which were already neurological, such as decompression sickness, arterial gas embolism, and carbon monoxide poisoning. Now, we'll talk about the mechanisms just now, but one of the most important things that is changing in our thought process when it comes to the brain is that previously we have thought about the brain as this mystical organ that supports a number of functions, but we have never thought of it really in terms of a tissue that can be wounded. And so, yes, hyperbaric oxygen therapy is involved with advanced wound care, but guess what? The brain is also an organ that can have a chronic wound. And that is a central theme that I would like you to remember. So if we look at HBO in neurology and neurosurgery, it started in 1908 with the treatment of decompression sickness, then gas embolism, another 4 decades later, carbon monoxide poisoning in the 60s, traumatic brain injury in the 70s, acute stroke in the 80s, cerebral palsy later on, first, of course, chronic stroke, autism, which remains controversial, But here we've moved into an arena of three conditions, actually four that I'll talk about, but they are fibromyalgia, PTSD, long COVID, and neurological decline, which may be the result of an organic process or a result of traumatic brain injury. Now, why is this important? Well, what is strange is that over the past 100 years, we have developed complete confidence that hyperbaric oxygen therapy is appropriate in the treatment of bubble problems, decompression sickness, and gas bubble disease, arterial gas embolism in particular. But we know when we treat it up to a month after the original insult that we're not treating the bubbles anymore. The bubbles are long gone. What we're treating now is a post-ischemic insult with tissue that is stunned, has not resumed former function, some of which has died in the initial assault, some of which underwent delayed neurological deterioration and apoptosis. And we are now providing hyperbaric oxygen therapy post-hoc, after the original insult. And yet we're convinced that it works. And indeed it does. But if you think of it, a stroke is no different to this. By the time, several days after the original stroke, the blood clot is typically gone. And we're also dealing with an injured brain that is undergoing this hypometabolic dysfunction, some of which is dead, some of which is dying, but a significant amount that simply hasn't resumed its former function. So it stands to reason that we should be able to apply hyperbaric oxygen therapy in neurology. And the question is, where does it fit? How do we select patients? And why have we happened upon this combination of neurofeedback and hyperbaric oxygen therapy? So I'm going to start off with the hyperbaric side and the indications related to that, then move to the neurofeedback side and explain why we've put them all together. Well, the mechanisms of HBO that apply particularly in neurology and neurosurgery are the release of stem cells. Now, as you're sitting here, parts of you, your organs are dying, and your stem cells need to replace those organs. So you have a continuous stream of stem cells that are circulating throughout your body, replacing skin, replacing heart, even replacing parts of brain. And hyperbaric oxygen therapy, after 20 hyperbaric treatments, increases the number of circulating stem cells 8-fold. So in a sense, HBO is stem cell therapy, if you like. It also rehabilitates cells that have reached the stage of senescence. What I mean by that is old, cells that no longer are able to divide. And what it does, it actually rejuvenates the multiplying or copying machinery called the telomeres. That's at the end of the chromosomes, just like a photocopier allowing you to copy a complete chromosome. Those are restored with HBO. It increases not only the function of mitochondria, but in fact the number of mitochondria in tissue. So it essentially sets tissues up for better use of oxygen. It modulates the immune system. What I mean by that is, instead of the body attacking itself or having a random inflammatory event, it is now modulated to be constructive in the repair of tissue. It stimulates the formation of new blood vessels, and in combination can induce neuroplasticity and improve neuronal function. Now, a major contribution that has come in our whole area of oxygen therapy as such has been the result of these three scientists that received the Nobel Prize in 2019 for oxygen signaling in cells. And what they identified and could indeed unravel was this mysterious molecule called hypoxic inducible factor. Now, this molecule is the single strongest stimulus in the body for healing. So when this molecule arrives or is activated in cells, it is an unambiguous signal to cells to undergo a healing process. And the fascinating thing is that hyperbaric oxygen therapy resets normal for the body, no longer as you're sitting here breathing 21% at 1 atmosphere, but it resets it now to 2 atmospheres of 100% oxygen. And so the profile that we're using today is at 2 atmospheres, but we provide 4 5-minute air breaks, not to prevent oxygen toxicity, which was the reason for air breaks in the past. Yes, of course, we do it for that as well. But very importantly, for the high oxygen in the chamber to be varied with twice atmospheric pressure breathing air in the chamber. So you go to hyperoxia, normoxia, hyperoxia, normoxia, yo-yoing through the treatment, and then, of course, between treatments. And in the process, the body now adopts a new normal. And the new normal is 2 atmospheres of oxygen. And the body ramps up all its resources, all its mechanisms and biochemistry to meet this new normal. And in the process, rejuvenates and modifies a number of processes. Now, we all want to have evidence. And what is amazing, if we look at the Oxford scale of clinical evidence-based medicine, the indications I'm going to be talking about today are actually at the highest levels of evidence. We're talking about randomized controlled trials, many of them sham controlled, in other words, untreated individuals compared to treated individuals, where both the patient and the treating doctor was unaware of the treatment they had. That's the highest level of evidence there is. And in this setting, the use of hyperbaric oxygen therapy in long COVID syndrome that affects 20 to 30% of people who either had symptomatic or asymptomatic COVID and have an aftermath of mental fogginess. When they exercise, they experience flu-like symptoms, gastrointestinal upsets, still ongoing loss of smell, and a variety of other neuropsychiatric conditions that follows 3 months after having COVID, knowingly or unknowingly. And until now, there hasn't been a treatment for it, other than perhaps antidepressants or non-specific ways to try and improve the mental fogging. HBO has been shown to reverse the neurocognitive changes to pre-morbid status. In other words, back to where the person was before they got COVID. And in our own department, with the number of patients we've treated so far, we've had individuals that had lost their sense of smell for 2 years and regained and started to regain it within 4 hyperbaric treatments, with a full recovery after 20 treatments. So it, in our own hands, as well as in the literature, is well substantiated. But not only the brain, the heart as well. There's evidence that the heart damage induced either by the virus or the vaccine can be reversed, and the ability of the heart to contract is restored to normal. Another important area is concussion and traumatic brain injury, and here we have very high level of evidence, and in fact the latest was published this year. Double-blind, randomized, sham-controlled crossover study, that's essentially bulletproof, ironclad, that was able to show that in this group of traumatically injured brains, the individuals had recovery of smell, reduction of anxiety, improvement of sleep difficulties and dizziness, and in addition, reduction of depression, headaches, PTSD, improved quality of life. And this was also borne out by those patients that initially were not treated on HBO and then crossed over and had the treatment later on. So this is a very powerful message that has arrived literally 2 months ago. Post-traumatic stress disorder. Now, some of you may be thinking, what on earth can hyperbaric oxygen have to do with post-traumatic stress or emotional trauma? Well, for this purpose, it's important to understand how the brain manages its metabolic requirements. Under normal conditions, the brain extracts more oxygen than is available. And so therefore, the way the brain is able to cope with this, and the brain weighs 2% of our body weight, but uses 20% of the oxygen. The way it does so is it moves the oxygen delivery through a process called neurovascular coupling. In other words, the neuron function and blood vessel diameter is linked so that circulation is selectively moved to the parts of the brain that are active. And so if we are thinking about language, this part is activated. But if there's an emotional distress, there's a hidden part of the brain under this part called the insula, where we experience these visceral, uncomfortable, distressing symptoms. And if that's activated and all the circulation goes there, the person loses the capacity to think clearly, and in fact, they lose their sense of language, so that these people develop what we call alexithymia. They no longer have the ability to describe how they feel because that part of the brain is offline. Now, this is a common denominator with traumatic brain injury, with PTSD, and certain aspects of fibromyalgia. And why HBO has something to offer is because for the first time, the brain doesn't have to select where the circulation will go. Every part of the brain has more than enough oxygen to do whatever is necessary. And that is why what they have found in treating patients with post-traumatic stress, that the memories that have been repressed start coming to the surface. And we're talking about resistant cases of post-traumatic stress. So the mechanisms, of course, include oxygenation, and bearing in mind the hippocampus, where our memory is seated, has of the highest requirements for oxygen. Anti-inflammation, many of these conditions have an inflammatory component, and of course, they don't necessarily work optimally as far as oxygen metabolism is concerned. And here is the study showing in post-traumatic stress, the changes in the brain. So these are patients that were the control group. And as you can see, the parts of the brain that light up before and after are exactly the same for obvious reasons. They didn't get any active treatment. But look at the change that occurred. The initial looks the same. But at the end of hyperbarics, parts of the brain, notably the parts involved in language processing and high executive function, are back online. There is no other therapy that does this. What has been reported, as I mentioned, is that memories surface during the hyperbaric treatments, which is why the treatment should be directed and focused, both in terms of where the brain is treated, but also the psychiatric and psychological support that is necessary during this process. And this has become an exciting area of assisting people that previously was not available. Fibromyalgia, a condition of chronic fibromuscular pain, which is poorly understood, also has the same neuro dysregulatory features that we see in aspects of PTSD. And in this randomized controlled, sham-controlled crossover trial, it was obvious to see the improvement, the lessening of pain, improvement in sleep, and a variety of other features, which also was present when they did the crossover. In other words, there was no improvement when the people had the sham, but when they then subsequently got the active treatment, the previous controls had the same levels of improvement. Again, a very powerful message. So that's HBO. Now let's look at neurofeedback. What is neurofeedback? Well, neurofeedback is not as complicated as it may sound. It is basically a way to teach the brain to self-regulate, but it's done in a very unique way. And this is a simplified way of looking at it. Let's look at the client essentially to start off with. Their brain has an electrophysiological signature based on function or dysfunction. After doing a quantitative EEG analysis, we are able to see which parts of the brain have a problem, are offline, are inattentive, or are somehow irritated. Those parts can be identified, and then a particular protocol can be developed in which we reward certain brain frequencies and inhibit others. Now, that sounds complicated, but it isn't really. What happens is we adjust through a software process which frequencies are desirable. And they are typically the hum of the brain, which is the sensory motor rhythm of 12 to 15 cycles per second. Those frequencies below 10 typically are dreamy, unfocused states, which are inhibited. And those above 20 cycles per second are related to anxiety, which are equally undesirable. and the mid frequencies, the 12 to 15, are enhanced. And when I show you the history of neurofeedback briefly, you'll see why this is so important. Now, once we've set up, and you'll see how this actually works in real life in a moment, but what happens is the computer guides a video or video game that the patient is watching, and to the extent that their brain conforms to what is set to the ideal paradigm, low dreaminess, increased stability, lowered anxiety, to that extent, the video plays or stops, or brightens and darkens, and sound normalizes or disappears. And all the person needs to do is to stay awake and to want to watch the video. Because if that is present, then the brain will figure out for itself what state it needs to be in for the video to play. And amazingly, after 15 sessions, these changes are permanent, between 15 and 25 sessions. So unlike medication, which you need to take and keep on taking, we are here establishing neuroplasticity and, in fact, new pathways. So in terms of the clinical history of neurofeedback, in the 60s, for the first time, we realized we could, in fact, change the way the brain thought on an electrophysiological level. And over the years, Barry Sternborn was able to show that you could stop epilepsy in 65% of patients undergoing neurofeedback. And we're talking about literature that's 60 years old. Lubar worked with ADHD. Eugene Peniston with alcoholics and emotional trauma, Seaburn Fisher with a fear-driven brain, and Martijn Arends also with ADHD, and most recently, Susan Whitfield Gabriel in the area of neuropsychiatry. So with this background, does neurofeedback have anything to offer in those 4 conditions we covered? Yes. In COVID, we don't have a series, but we've got a very well-documented case that shows the changes in brainwave states as a result of a recovery of mental fogginess in a patient who had long COVID. In concussion and traumatic brain injury, we actually again have randomized control literature showing that the brain can recover with improved memory, attention, and productivity. With post-traumatic stress, similarly, we have a systematic review of at least 7 randomized controlled trials showing that neurofeedback works for post-traumatic stress. Fibromyalgia, the same, randomized control evidence. So why not combine hyperbaric oxygen therapy and neurofeedback? If we can guide the brain into the state it should be in, and if we can provide it with the resources it needs at the time that it needs it during the learning process, so that whichever part of the brain needs to function has the necessary energy requirements met, intuitively, it should work. But is there evidence? Well, we would anticipate improved cognitive function, improved brain plasticity, reduced inflammation, and importantly, improved mood and emotional regulation. And in fact, already in 2009, a patient who was trained to literally guide blood flow in the brain by thought. This was a patient who suffered an injury leading to cortical blindness. And after developing the ability to shunt the circulation to the part of the brain responsible, the occipital part, and getting HBO, this patient regained their sight years later. This is a case of a combination of HBO and neurofeedback, but not at the same time. And so these patients typically have received 160 or more hyperbaric treatments, and in certain cases, up to 300 neurofeedback sessions. That simply is unattainable for most people. And that is what has led me over the past 15 years, with the ability to do so only happening since being here in Bahrain, to combine HBO with neurofeedback. And on the 9th of August last year, the team that you see in front of you had the privilege of doing this for the first time. And here you're seeing our very first patient being treated with a combination of hyperbaric oxygen therapy and neurofeedback. So the sensors are applied to the scalp in the areas of the brain that we want to stimulate. The configuration is set up to reward and inhibit the frequencies, and you'll see them in a moment. And then the patient enters the hyperbaric chamber. And this is the computer program by Mind Media. At the top, you can see the raw EEG, and these are the frequency bands that we're training. And as soon as the patient is at 2 atmospheres, we dim the lights and they watch a movie. And while they are lying in hyperbaric oxygen, they now are being trained. 20 minutes on oxygen, and then they relax for 5 breathing air. And the brain figures it out for itself. And basically what we needed was to bring the Bluetooth device, the amplifier, connected through the chamber hole, and this being the key piece, moving from the outside of the chamber to the inside and allowing us to provide the therapy simultaneously. And so therefore, we are now at a stage where we believe that these 4 conditions can be treated in a revolutionary way. And our preliminary experience has been very, very encouraging. And I would welcome colleagues, those of you that are watching, those of you that are involved in this field, but perhaps even those of you who have family members or patients that you are aware have been struggling with these conditions. They no longer need to be in despair and without hope. We really have not only the evidence, but the experience to show that changes can be brought about in a very significant and meaningful way. Any of you that want access to the references, I'm very happy to provide them to you. But most importantly, we would really like to collaborate with you in this new and exciting journey that we have just introduced. Thank you very much.